My name is Javier Ceballos, and today's day is August 20, 2023. And the class today is Biology 240, Anatomy and Physiology, second part. Today we're going to talk about the urinary system, and we're going to do some dissections of the urinary system. We're going to get a little bit closer here. We're going to talk about we're going to find out the adrenal glands and the kidneys on our piggy dissection here. So here we have the left kidney and a left urethra, a left adrenal gland, which is on top of the kidney, which is this part. This is the adrenal gland, this is the left kidney, and this is the left ureter right here. And this is the right kidney, and this is the right adrenal gland right here on top, and this is the ureter right here, which is I broke it a little bit, but this is the right ureter. The urinary bladder is right here on this part. This is the urinary bladder. As you can see here, this is the urinary bladder. The two ureters, they get together from the kidneys all the way down here, as you can see it, and they meet in the urinary bladder, which is this part. Now we're gonna talk about the renal arteries, renal veins, and renal cortex and renal medulla. The fat located around the kidneys is the layer that covers the kidneys, which is on top, which is right here. I already remove it. So the kidneys and the ureters and the bladder are in the peritoneum. I have a kidney dissection, which is not a piggy kidney, but she's a cheap kidney, which I'm gonna show here the renal arteries. As you can see here, the renal arteries is here. This is the renal arteries right here on the kidney. As you can see here, this is the renal artery, and this is the renal vein, which are two different ones. As you can see here in the blue, renal vein and renal artery. The renal cortex, which is the outside layer at the kidney, which is the upper part right here. This is the renal cortex. Renal medulla is everything inside this part. Again, this is the renal cortex and renal medulla. And renal artery, as you can see here, and renal vein, which is the blue vein. And the disease we're going to talk about today, we're going to talk about UTI. UTI is a urinary tract infection that is more common on women because the urethra is shorter. And the main bacteria that cause the UTI is the, the E. coli bacteria, which live in the bubbles, which cause this urinary tract infection. The anatomical changes about the UTI usually is it causes inflammation in the lining of the urinary tract. Some of the symptoms that people have when they have urinary tract infection is a strong feeling to urinate, which doesn't go away. Also, another symptom is burning sensation when people or when patients are peeing, and when they pee, the smell of the pee is kind of strong, yellow. Also, they have pelvic pain, and when the UTIs are really severe, may cause, we say severe meaning like when the infection is going into the kidneys. It will cause lower back pain, nausea, vomiting, and fever. Uh, some treatments for this kind of urinary tract infections are antibiotics. Antibiotics are given by the physician. Also, it's recommended to drink plenty of water to flush, to get rid of all the infection in your bladder, kidneys, and ureter. Some possible medication that the doctors will give you is the most common antibiotic, which is amoxicillin. It's the most common medication for urinary tract infection. The other medication that people will have is doxycycline, I think is what it is, together with the amoxicillin. Those are the two medications to treat urinary tract infection. Uh, some tests that the doctor will diagnose to have urinary tract infection is urinalysis and urine culture. And when the UTI is severe and is going into the kidneys, some of the doctors they order ultrasounds and CAT scan of the abdomen or pelvis. To prevent this kind of infection, um, usually it's recommended to drink plenty of water and practice good hygiene. Uh, and never hold when you need to go to the bathroom. Never hold it, because this is what it happens, that you're holding your pee and your pee is going up into your kidneys, which cause a lot of infection. So this is all for today. Thank you so much and have a good night.